Good evening. My name is Dr. Nadiminti, and I'm here to speak to you about seizures. So we're going to talk about everything from diagnosis, treatment, and special consideration in people with brain tumors. So we'll go through the ABCs of seizures.
So a couple of true or false that people may or may not know about seizures. Potentially anyone can have a seizure. True or false? Seizures were once thought to be the possession by evil spirits. True. Medications are the only treatment for seizures. False. The type of brain tumor can influence seizure risk. True. All people with autism have seizures. False. And if an EEG reports come back negative, then that means you don't have underlying seizure potentials or epilepsy. False. Okay. So epilepsy and seizures affect over 3 million Americans of all ages at an estimated annual cost of $15.5 billion in indirect and direct costs. Approximately 200,000 new cases of seizures and epilepsy occur each year. 10% of the American population will experience a seizure in their lifetime, and 3% will develop epilepsy by the age of 75. So what exactly is a seizure? It's a self-limited event caused by an excessive electrical discharge of the central nervous system. So it's really like a revved up electrical storm in your brain.
So who can have a seizure? Any brain, given the right circumstances, can have the potential to have a seizure. And these are known as provoked seizures. These are seizures that are caused by a transient reversible disorder. When that disorder, the underlying condition improves, then the person is no longer at risk for a seizure. And a person with only provoked seizures do not have epilepsy. Common causes for provoked seizures are illicit drugs like cocaine, PCP, amphetamines, drug overdoses with a multitude of different drugs, drug withdrawal, benzodiazepine, either having too much or withdrawing from alcohol or barbiturates, toxins like organophosphates that are found in pesticides, and then a whole slew of metabolic abnormalities, including high thyroid levels, hypoglycemia or low blood sugar, hyponatremia or low blood sodium, water intoxication causing low sodium. There are certain conditions where people with psychiatric disorders drink so much water that they drive their sodium down to the point where they're having seizures. Hypocalcemia, low blood calcium, or hypomagnesium, low blood magnesium. So basically any severe abnormality in your metabolic parameters can cause a seizure. So the other category is unprovoked seizures. There's something that has changed in either the substrate or the way the brain is functioning that has increased your risk for having a seizure. So examples of that would be an underlying vascular problem, a problem with either the arterial system or the venous system of the brain. This could include strokes, bleeding in the brain, hypoxic ischemic injury, for example, after a cardiac arrest, perinatal asphyxia, so in utero injuries, venous thrombosis, which is a clot in the venous system of the brain, which is common in dehydration or pregnancy, arterial venous malformations, infectious etiologies, anything affecting the actual brain or the covering of the brain known as the meninges could provoke a seizure. Viral encephalitis, bacterial meningitis, cysticercosis, toxoplasmosis, abscesses. So any infection either causing direct injury to the brain or covering of the brain could potentially increase your seizure risk. And then tumors, either gliomas, meningiomas, or metastatic tumors. These are all can be associated with seizures. Degenerative disorders, for example, Alzheimer's risk, there's a 10% increase in patients who are diagnosed with Alzheimer's disease to develop seizures. And in multiple sclerosis, there's a 5% increased risk for developing seizures. Immune-mediated responses like lupus, Sometimes it can cause cerebritis or vasculitis of the brain, and in turn that damage can make people more susceptible to having seizures. And congenital malformations, there's so many, but most common are the ones listed: heterotropia, schizencephaly, lissencephaly, and microgyria. These are all different sizes or shapes of the kind of grooves of the brain that in certain circumstances can increase the seizure risk. Trauma, so concussions, we hear that a lot about that in the news now with football players, so it can be concussions that happen immediately over long-term injury. Cerebral contusions, which are bruises of the brain after trauma, or subdural hematomas, that's when a blood collection forms between the skull and the top of the brain after a trauma.